Hello friends, welcome back to Easy Nurse with another amazing video. In this video, today we'll be discussing about community health nursing GNM first year. Okay, so you know community health nursing is a very easy subject, right? But there are way huge topic to be discussed. So you are confused literally what to study, what not to study, what to write, what not to write. And because it's just before the exam, you guys maybe are panicking or what. Okay, so I am here to help you guys. So you don't have to go through all your books, all your notes and all. You can just watch the video. You can have an idea how to write and what is the actual concept of that. So you don't have to remember or recall it during the exam. You can just understand and write it by your own. Okay, so in this session I will be discussing regarding different types of important topics. So let's just start with the community health nursing. So what is community health nursing? So as per the American Nursing Association, the community health nursing is a synthesis of nursing and public health practices applied to promoting and preserving the health of the people. So what it does, it actually do the synthesis of nursing and the public health practices we will be applying for promoting and preserving the health of the community people. Okay, so this is the definition of community health nursing. Move on to the principles. So now if we are a community health nurse and we are providing care to the community health people, there are some certain rules, regulation and principles that we should maintain. So what are those principles? This include first one, plan of service based on the community need. Okay, before giving any kind of service, we have to plan the services based on what? Based on the community need, in which particular aspect they need the support and all that we have to see. Move on to the next one is be professionally qualified, like she have to be diploma graduate or postgraduate in a particular professional degree. Okay, do not accept any kind of gift or bribes from the people, okay, or from their patient or family members. Okay, now follow the agency policies which they will be related to. It can be NGO, it can be any health center and all. Avoid political involvement. Ensure the proper job facilities and condition. Work as the key member of health team. Maintain the professional relationship with the community leaders, and also follow the professional ethics. Conduct in-service educational programs. Okay, so these are the main principles of community health nursing. Move on to the next one. We will see what is the meaning of health. So this is from the first we are learning this, right? So what is health? Health is a state of complete physical, mental and social well-being, and not merely absence of any disease and infirmity. Okay, it is described by the WHO, okay, or World Health Organization. So now if we are going into a community and we want to promote the health level, or we want to maintain the health of the community, what we have to do? We have to do the health assessment. So how we can do that? So according to Hopin, health assessment is actually, or nursing assessment, it is a continuous, systematic, critical, orderly analyzing and interacting information about the physical, psychological, social need of a person, the nature, self-care, deficient, other factors influencing the condition and the care. Mainly it will assess a person's all perspective way in a particular manner, okay, so that we can understand the health level of the person. So why it is needed? What is the purpose of health assessment? First of all, it is to identify the specific health deficit and guidance needed for the particular person, and to assume the probable effect nursing intervention of this condition and the effectiveness of nursing efforts while they are solving the health problems. Now in that, to do the health assessment, first of all we have to do the observation. In that, the community health nurse must be good observer during the home visit. They have to collect information by the observation and realistic situation of health practices. They have many things can be learned by the observation. Move on to the interviewing. Okay, she have to interview face-to-face conversation with a purpose. Along with that, she have to use a method which will be secure information such as facts, opinion or personal history of the patient or the family. So this is about the community health nurse and community health nursing. Move on to the epidemiology. This is also a very important topic. So what is epidemiology is? Epidemiology is derived from the Greek word which is called as epidemic, dating back to the 3rd century. The word epidemic implies to the EPI, which is means upon, demos mean people, logos means study. So it is the study of the people. So epidemiology is the study of or the spread of the disease within between the population. So in a population, how the disease is going to spread in that community or spread in that area, the study we will call it as epidemiology. So what is the main aim of epidemiology? Why we should study this? To determine the frequency and distribution of the disease in a population, to identify the etiology or cause, to achieve the control over the disease and find the solution, to assess the economic effect of a disease and analyze the cost of the economic benefits to alternative control program. So if the people are not able to, people are not able to access the services, if we make it affordable, the people can access that, right? So this is very important. And to develop and monitor the healthcare policy for the disease control program. So these are the main aims of the epidemiology. So there is the ultimate aim of epidemiology is to eliminate and reduce the health problems or its consequences, and to promote the health and well-being of the society as a whole. So this is the main aim of epidemiology. Now there are different fields of epidemiology, which is clinical field, geographical, social, statistical, descriptive, analytic, experimental, and infectious disease epidemiology. Now to know epidemiology, we have to understand the epidemiological model, which is also called as epidemiological triad. So it is a triangular model where the three components will be present: agent, host, and environment. So what are those? Agent is actually who bring the disease. Okay, it will be transferring the disease to the host through the or via the environment. Okay, via the environment. So agent will be transferring in disease or pathogens via the agent is called as epidemiological triad. So the example of epidemiological triad can be typhoid fever, which is the main causative bacteria or agent will be Salmonella typhi. It can be the environment will be polluted water, open defecation, and poor sanitation, and like from this only the Salmonella typhi will be transferred to the human body, especially in young age. Okay, plus males, low immunity power human being, and lack of personal hygiene. The common communicable diseases include smallpox, chickenpox, measles, rubella, diphtheria, pertussis, tetanus, and meningococcal meningitis. Okay. Smallpox is actually derived from the smallpox epidemiological triad include agent, virus, okay, environment, which is overcrowding, and the host will be all ages, both sexes. Okay, so chickenpox actually the agent is Varicella zoster virus, which will be the environment will be overcrowding, and the host will be under 10 years of age. Okay, here you can see measles, which agent will be paraximovirus, or it is RNA virus, and it is the environment or the transformator will be overcrowding and low socioeconomic status, and the host will be developed countries. Okay, in developed countries especially you can see that if the age is more than 5 to 10 years, and developing countries below 6 months and 3 years, you can see this kind of infection. Come to rubella. Rubella is actually caused by the RNA virus like tagovirus family, and it comes from the overcrowding or low socioeconomic status. The host affected is below 10 years and even older than 15 years. Other than that, diphtheria, pertussis, meningococcal meningitis, tetanus is there. Okay, so diphtheria, the incubation will be 2 to 6 days. The agent is Corynebacterium diphtheria. The host will be 1 to 5 years, both sexes. Environment is plus winters, and signs and symptoms is mild fever, sore throat, difficulty in swallowing, bull neck appearance, mucosal erythema, thick blue white gray membrane. Okay. Pertussis. Now its incubation is in between 7 to 14 days. The agent is B. pertussis nasopharyngeal bronchial secretion. The host is mainly infants plus females and preschoolers, how through which it transfer winters, spring season and overcrowding. The signs and symptoms include mild fever, sore throat, chills, rigor, cough, soreness, swollen lymph nodes. Meningococcal meningitis is caused by Neisseria meningitis. The host is children and young adults. Environment is for the overcrowding, low socioeconomic groups, dry and cold months of the year. The signs and symptoms include fever, chills, vomiting, fatigue, headache, neck stiffness and rapid breathing. Tetanus. Tetanus incubation period is 3 to 21 days. It is because of the Clostridium tetani, which is found worldwide in soil, feces and inanimate environment. The host is 5 to 40 years of age, especially in the males you can see, and occupational males. Okay, it is because of the environment, which is unhygienic customs, unhygienic delivery practices and lack of PHC or primary healthcare services. The signs and symptoms include fever, sweating, high blood pressure, muscle spasm, jaw rock, nervous system dysfunction and fast heart rate and stiff neck. If it is remain untreated, it can be leads to death as well. Other than that, we also have some common community health problem, that are malnutrition, influenza, coronary heart disease, non-communicable disease, diabetes and cancer. So let's talk about family. So as a community health nurse, we are giving, not only giving the individual care, we are giving also the family care, right? So what is family? So family is a group of 2 or more person who is related by birth, marriage, adoption or residing together in a household is called as family. It's stated by US Bureau. Okay. And NIMKOFF stated that family is more or less durable association of husband and wife with or without a children, or of a man and woman alone with children. Now there are different types of family. First of all is a nuclear family, which is consists of husband wife and their natural or adopted children. Okay, so move on to the next one. The next one is extended or joint family. Okay, now so what is that? This is completely different from a nuclear family. Nuclear family is a modern thing, okay, but previously it was only extended or joint family was there. So it is consist of nuclear family in addition to other who are blood related, okay, or marriage related. They are grandparents, they can be adults, aunts, cousins and type of family, and there will be different kind of change. There can be 2 generation or 3 generation of the offspring. Next come to blended family. Now what is that? Blended family is actually includes the married couples, one or both of them have been married previously, okay, and had a children from previous marriage, and couple has their own children as well. Like if I want to explain, it could be a divorced or maybe a descended wife, okay, and the husband is trying to get married to another woman, okay, so they have both their different children from different parents, but they are marrying it together and they are living it in a family, so it will be called as blended family. Okay, now come to the fourth one, is a single parent. Now who is single parent? A single parent is either male or female who lives alone with his or her child or children, okay. They may be naturally born or can be adopted child. So these are the types of family. Now to maintain family health nursing or to give a care in a family, what are the principles we should follow? So there are different principles. First of all, there should be no discrimination while giving the care to a family, okay, not regarding their age, not regarding their gender, not regarding their social status, their values, moral, culture, religion, caste, nothing, okay. We should have to be we have to give the care irrespective of their status, okay. Then periodic, it have to be in period, like interval should be there, and follow-up routine should be maintained. Information and education should be given to the family members, okay, to educate them on the health basis. Focus on the family as a unit, not on the individuals. Establish working relationship with them. Knowledge of family health care policies, goals and objective. Cooperation from family members. Nursing services should be realistic, okay. Family have to take decision, and reporting and recording is the final procedure. So these are the principles that as a family, as a nurse, we have to keep while we are doing the family health nursing, okay. Next is home visit. This have come at least 3 to 4 times from last 10 years, if you will see. This is a very important question, okay. Don't forget it. This is a very important question. So what is home visit, okay? So in community health nursing, if you see, we most most probably we will do the home visits only, because not always the surveys or camps are possible, okay. So other than the camps and surveys, we will usually go to the homes and we will visit them. We will take the information, record and report it, okay, and we can give advice regarding their health status. So home visiting is defined as a providing the service to a family at their doorstep to maintain the health and reduce the mortality and morbidity in the family, okay. So what is the purpose of home visit? Why we should, as a nurse, we should do home visit? So it is to identify the health problems, okay, to investigate associated causes, okay, of the problems. If any kind of disease is happening, why it is happening, okay, or what is the reason of that, we have to find out. Next is to provide the best possible care in home environment without disturbing their routine. Then to establish working relationship with the family members, to plan and implement nursing per need of the family, to assess the health status, immunization, nutrition and environmental hazard of a family which can affect their health, and to provide the health education during the home visit while giving the family health care. So these are the purpose of home visit, okay. If it is come for 3 to 4 marks, just don't explain the home visit, okay. Write this point. Under that you can explain like regarding this, like when identify the problem, we have to ask, we have to investigate, assessment, we have to do assessment, we have to ask questionnaires, okay. These things you can add, okay, and you can expand the answer, but this is the main gist. And if it is come for 3 marks, I think this is fine, okay, or 2 marks also, this is fine, but if you want to add more, you can explain it. Next is principle of home visit. What are the things we should maintain while we are doing the home visit? We have to we have to gain a flexibility in approach. Voluntary and convenient is very important. Good interpersonal relationship with all the family members, and it have to be very professional also. Then educative, like while giving the care, we are not only giving the care, but also we are educating them, okay, we are giving the health education. Then evaluative, just after taking the records, reports and all, just after taking the information from them, we have to do the evaluation, okay, what is their health status, okay, how, whether the health practices or whether the personal lifestyle they are doing, is that good or bad for them, okay, that we have to evaluate. Then use safe technical skill while giving the care. Collect information before visiting, okay, before visiting them we have to collect information regarding like how many members and all, okay. Based on need, we should give care. We have to be kind and courteous, regular and planned and purposeful based on the care. So these are the principles of home visit. Now there are 6 sections of family for visits, okay. So based on the priority, after the priority we will look for the needs that is related to health by the family, okay. We have to be available the time. We have to look for workload and community health nurse. Then policies of health agencies, okay. So this is about the home visit. Move on to the back technique. So what is back technique? bag technique is actually a community bag is there. Okay, so now there is a bag which is called as community bag. In that bag there will be all equipment that you need while doing the home visit. Okay, it include newspaper, different compartments in the bags are there. I'll discuss it later. Just for now, just have a have a brief idea. So community bag is a bag which contains medicine equipments required for providing care to family during the home visits. Okay, remember this question have also came for 2 marks. Okay, this is also very important. I know I have giving too much important question, but please believe me, this question have repeatedly asked, so that's why I am only giving this. So community bag, we have learned the definition. Okay, so it is also described as it is a vehicle to carry tools required during the home visit. It is made up for strong but light material like canvas, leather, plastic or light metal, and it can be carried in hand or on the shoulder. Here you can see I have included one picture of this. If you have any doubt, you can go in your lab, in your colleges, in your community lab is there, you can find this. Okay, or in your community posting you will definitely get to know about this. Okay, so principles of bag techniques. Now there are some principles while you are giving care and using the instruments of the bag or using the bag, how you should use the bag and all. There are some principles to maintain. So let's discuss it. So first one is always check the content of the bag before leaving from the home visit. Okay, for the home visit. So whenever you are going for a home visit, before that you should always check whether all the contents are present or not. Then bag, its content must be kept clean, ready uses for all time, and especially the reusable things have to be sterilized before using it for the next home visit. Then hand must be washed with soap and water each time before touching the bag, because the inside the compartment it have to be sterilized. Then bag should be placed in a clean, safe area without danger or contaminated by domestic animals. Okay. Then all articles used should be clean with soap, water, boiled and replaced for the next time. Things like pen, pencil, handkerchief, cell phone should not be kept inside the bag. You have to carry it inside your pocket of the coat, okay, or in the dress, nursing dress. Okay, so these are the principles of bag techniques. Now there are some articles that present in the community bag. Okay, so let's talk about that. So first is soap, dish, nail, brush, towel, one of each. Apparatus for giving enema, one each. Urinary catheter, rubber and disposable foils, catheter, one. Clinical thermometer, blood slider, wrapper, rectal thermometer, pair of scissors, pair of artery forceps, pair of dissecting forceps, small gallipot, 4, and bowel, 6, kidney trays, bag of sterile dressing and measuring tapes. Then fetoscope, BP instrument, stethoscope, bag of sterile swabs, spring balance, disposable gloves, large cotton bag and carry home equipment that cannot be disinfected, disposable syringe and pricking needles, spirit cotton balls, mucus sucker. Then cold ligature, eye antiseptic, urine testing kit, glucometer, sterile delivery kit, plastic apron, rubber sheet, plastic sheet, paper bag and newspaper, antiseptic lotions, bandage and tape, baby feeding tube, prescribed medicine and all, small diary, pencil, pen to be kept in the outer pocket. So these are the list of the articles that are present in the community bag. So now we are collecting all the information from the family during the home visit with the community bag and all. Now after giving care and all, okay, after again washing the hands and all, we have to do the records. Okay, why records are important? So actually first to know what the records are. So records are the presentation of facts, figures, date and other information in writing as a evidence, and a record which is permanent written presentation of information. A record that is that which are written of a knowledge of event. Now there are different types of record: cumulative record, family record, anecdotal record, clinical record, doctor's sheet, order sheet, nurse's sheet, and other records. Okay. So other than that, we have TRP charts with temperature pulse report chart, lab report sheet, diet sheet, or like dietary intake and output like food, water. Okay. Then anesthesia chart, physiotherapy sheet, and special treatment sheet. So these are the other types of record. Next are reports. So what are reports? Reports may be form of the analysis of some aspects of a service. It usually written in daily, weekly, monthly, and yearly. So there are different types of reports such as oral reports, written reports, hour reports, census, and accidents. So these are the types of reports. Now let's move on to the types of standing orders. So what are the types of standing orders? Standing orders include instructional standing orders, specific standing orders, and general standing orders. So what are instructional standing orders? It is actually the category which includes the standing orders prepared with a view of available resources, staff, objectives of medical institution for the hospital or the hospital. Okay. Its standing orders are different from the PHC than those are in the district hospital. Okay. Now come to second one, the specific standing orders include this type of standing orders are prepared for the trained medicine personnel, mainly for the nurses. Okay. The technical knowledge and special skill are required to implement this kind of order. Come to third one, which is general standing order. It means due to large population or geographical area, the shortage of the health resources, some standing orders are used to propagate the health message to the masses. Common man is expected to follow these orders. The advice is to drink ORS and diarrhea. In the diarrhea. Okay. So this is the general order. Okay, so these are the different types of order. Now let's come to common minor alignment. So what are the common minor alignment that can happen inside the community? The most common one are fever, heart attack, burn, diarrhea, wound, fracture, injuries, drowning in the water and all, bites, and fainting. So what is the role of a community nurse with implementing minor alignments? Okay, so what is our responsibility? To take general history and about the onset of the disease, symptoms, and history of the illness in the family. Finding out any kind of actions have been taken or complication if any present. We have to record vital signs and nothing the condition of the patient. Okay. Then to identify the problems of personal needs. Okay, so if a person got any kind of minor elements or any kind of disease, what is the need of the person, that we have to figure it out. Then provide the first aid treatment and care as per the guidelines and standing orders. Okay, so these are about the role of community health nurse. Okay, in the implement minor order, it can be come for 2 marks. Okay, don't forget to write it down. Okay, and if you still feel like you have some kind of confusion and all regarding the topics, or maybe you didn't have understood right now, then you can obviously put a comment. I will be happy to help you guys. I will be giving the direction, or I will be happy to discuss whatever the confusion you have. Okay, so do follow Easy Nurse and obviously put a comment whatever the topic you need to study. Okay, and lastly we have provide the first aid treatment as per the guidelines and the standing orders. Okay, move on to the next one is health education. Now in a community health nursing, health education plays a major role. Why? Because in community health nurse, maybe exact individualized personal care is not possible all the time. So if rather than giving individual care previously or before the onset of any kind of disease, we can able to educate the people regarding any minor alignment, how to maintain the personal hygiene, how to prevent any kind of disease, I think that will be more efficient, because we are doing like we are awareing the people. So the people, if the people or the community will get aware or get educated on the particular topic, or how they should avoid that kind of disease, okay, how they can avoid it, then the morbidity rate will obviously be decreased. Okay, so that is the main point of giving the health education. So health education is a process of imparting knowledge, skill, values, individual or groups to help them make informed decision and take positive action towards promoting and maintaining their health. So what we will give in this, in health education, we will try to give the knowledge, skill, values, to whom? To the individuals or group of people. Why we will give it? To make them helping to take the informed decision and take positive action towards the promoting and maintaining their health. So this is about the health education. Now before giving any health education, we have to know what are the objectives are present. Okay, so what are the objectives? The objectives include promoting the health. The primary objective of health education is to promote the health by providing individuals with knowledge and skill necessary to make healthy choices and adopt healthy behaviors. The second one is preventing disease. Now during the health education, not only we will tell about the only signs, symptoms, the causes and all, we will also tell like how they can prevent the particular disease. Okay, so it seeks to prevent the disease and injuries by teaching people how to avoid risk and to take appropriate preventive measures. The third one is encouraging self-care. The health education encourages individuals and injuries by teaching people how to avoid risk and take appropriate preventive measure. The encouraging self-care is actually health education encourage the individuals to take responsibility for their own health and well-being through the proper self-care practices. The fourth one is enhancing quality of life. Now enhancing quality of life, it can't be only include the health status. Okay, not only include health status, but the person, the family members also have to be mentally, physically with the society healthy, and also along with that they have to have a good relationship with the society. Okay, so okay, so they will promoting the healthy lifestyle, reducing the stress and improving the mental health of the persons. Next one is increasing the health literacy. Now increasing the health literacy is come under the health education aim to improve the health literacy, providing individuals with the knowledge, skill and necessary understanding health information and make informed decision about them. Okay, next is empowering individual and community. So in the health education, whenever we are trying to give a health education, we have to encourage them, we can empower them, individual and communities, to take action regarding their or improve their health and advocate for policies and programs that promote health and prevent the disease. Now there are some principles while we are giving health education we have to follow. First one, understanding the health. Before giving any health education, we have to understand about health. What is mean by health? How we can prevent any kind of factors affecting health. Okay, so we have to understand the health. Next is participation. You have to encourage people, communities, individuals to participate in the health education. Next is cultural sensitivity. While giving the health education, we should have to always be remember about some sensitive contents. Okay, if any kind of health education practices and all will go against the religion or against the caste and all, or they are harming their cultural values, then it can be harmful for as a nurse, or they will not gonna support, or next time they will not gonna coordinate with you. Okay, so we have to look after the cultural sensitivity as well. Okay, then evidence based. Whatever the health education we are giving, it have to be evidence based, like by the previous cases, by studying the previous cases which have been cured on the particular way, okay, through which we can take the evidence, and based on that only we should always give the health education. Next is communication. A good interpersonal communication should be there in between the learners and the providers. Okay, then collaboration with the community and the community leaders, lifelong learning, sustainability of the health education. Okay, so these are the principles of health education. Now levels. Now health education have 3 levels: primary prevention, secondary prevention and tertiary prevention. Okay, so that is all about the health education. From health education up to 5 marks question was there. Okay, but it is not that much important, I will tell, but like if it is come, so you don't want to miss the question, right? So what you just do, just listen to that first, at least try to remember the definition and what is mean by it. Okay, or while giving the health education to the community people, what are the things you have to be remember, or what are the principles you should follow. Next is communication. So what is communication? Communication is a process of transferring the information from the sender to the receiver. So it is also can be defined as the social interaction where at least 2 or more people interact and share through common language. It may be also defined as a process of exchanging information and ideas between 2 or more people. So there are different process of communication. It include, there is a process of communication. So what is that? So first there will be sender or source, through which they will send a message, it encoded through the channel and send it to the receiver. The receiver will decode the message and give a feedback. So this is the process of communication. Now there are different types of communication. These types of communication can come for 5 marks or can be for 10 marks, 7 marks, 4 marks. Okay, this is also a very important question. Okay, this is a very important question. So the types of communication is been divided into, first of all, 3 types. Okay, one-way, two-way and verbal communication. So one-way communication is in between that, one-way communication, two-way communication, verbal, non-verbal communication, formal and informal communication, oral communication, written, upward, downward, visual and horizontal communication. Okay, so these are the types of communication. Next is healthy environment. Okay, so what is healthy environment? Why it is needed, or why we have to study or why should we maintain the healthy environment while giving the care of a person is living in a particular area, why he should maintain the healthy environment. So healthy environment is very important for improving the health status of the individuals and the community, protecting the population against the disease, protecting the people from environmental hazards, reducing the morbidity and mortality, protecting against the communicable and non-communicable disease. So these are the importance of maintaining the healthy environment. So what is the purpose? Why we should do this? The purpose of environmental health is to maintain ecological condition to promote the health and thus prevent the disease. So there are environmental factors that contributing health. Okay, so before that we will learn in the maintaining the environmental health, what are the team members are present. So there are auxiliary staff, town planners, health inspectors, CHN or PHN, okay, community health nurse or public health nurse, economist, sociologist, physician trained, okay, epidemiologist and public health engineer. So these are the members of the team. Next we will discuss about nutrients. So what is nutrients? Nutrients are actually the substances that are essential for growth, maintenance and repair the body. They usually found in the food. Okay, they are obtained from food we eat, are required for specific amount for the proper functioning of the body's various system. Nutrient can be classified into 6 categories, which include carbohydrate, protein, lipid, water, electrolyte and vitamins. Carbohydrate plays a major role in the energy. Protein is essential for growth because it repairs the tissue and also serve enzyme, hormones and antibodies. Fats serve as a source of energy, insulation and protection of the organs. Come to vitamins. These are the organic substances that required in small amounts to maintain the health. Minerals, these are the inorganic substances required for various body functions such as bone formation, muscle contraction and nerve function. And water, what is essential for life, because in a human body there is 70% of water of the body weight, okay, and as it helps to regulate body temperature, transport nutrients and remove the waste. A balanced and varied diet is very important to ensure the body receives all necessary nutrients at the right amounts. Now, to which type of food we should take to maintain all the nutrients. Before know that, we have to know about classification of food. So there are objectives. Based on the objective, they are classified by origin, chemical composition and sources, and predominant function and nutritive value. Classification by origin is plant source and animal source. Plant sources are oil, sugar, cereals, legumes, tubers, vegetable fats and vegetables. The animal source are crabs, okay, pigs, cattle, sheep, turkey, chicken, egg, okay. Classification by predominant function is protein, which is come from fish, milk, egg, meat, in the most high amount for the bodybuilding. For the protective foods are vitamins and minerals. Energy yielding will be carbohydrate, cereals, dried food, roots, tubers, sugars, oils and fat. The classification by chemical composition source are carbohydrate, protein, fat, vitamins, minerals and phytonutrients, okay. So these are the classification of food. And classification by nutritive value will be micronutrient and macronutrient, okay. So I have discussed all of the topic, okay. Rather than that, some different topics also can come. Write it down, I am telling it now. How to do a family planning, what are the nursing responsibilities of a community health nurse, okay. Then what are the contraceptive methods, and what are the role of a nurse in surveying the community health, what is the epidemiological triad, okay. These are the most important question rather than whatever we discuss. If you have any confusion regarding the other topics or you want to know the other topics, you can go and subscribe Easy Nurse course plan. So there the way different types of teacher have already discussed all the topics, okay, which are very important for your lesson. And their notes are also available. If you don't want to purchase this one, you can still get the notes for list price. You can go ask in the comment section, we will be very happy to help you. So that's it for today, guys. I hope you guys have well understood about this session. See you in the next session. Till then, keep learning and keep exploring with Easy Nurse. Thank you.